envelope to ensure that they keep their MassHealth coverage, or if they no longer qualify, to ensure that they are connected with the MassHealth connector to get health insurance through them. So thank you all for joining us. I'm joined today by several of my Mass Housing colleagues, David Eng, who you will hear from in a little bit, as he will probably moderate our questions and answers, as well as Kelly Hetrick, who is my partner or teammate in production. And then, of course, we are joined by Emily Cooper, who is a special advisor on housing from MassHealth, Toby Roper, who is a senior strategy manager also from MassHealth, and Nikki Conti, who is the associate director of public outreach and education at the MassHealth Connector. A little bit about Mass Housing before we go on, and I don't want to take any of their time away from this important topic, but of course we always have to do our little sort of Mass Housing 101 spiel. So Mass Housing, as many of you know, if you are new to us, we are a quasi-state agency located in the Commonwealth of Massachusetts. We are a multi-billion-dollar lending bank. We only lend money, and we do that to create low and moderate income housing across the Commonwealth. We do that in two different ways. We have our home ownership division, which provides first-time homebuyers with low interest rate mortgages and some great mortgage insurance products and other lending programs for a single family, two family, or three family home that is owner occupied. So as interest rates go up, that homeownership side, our mortgages on that side continue to have lower than the market interest rates. So that's a great product if you know of anybody that is looking to purchase an owner occupied home. So feel free to check more or get more information about that at www.masshousing.com. And then, of course, there is the other side of Mass Housing's lending business, which is our multifamily rental side. And that is the side that all of you work in or around, sort of either providing as part of the property management team, perhaps on site, such as a resident services coordinator, property manager, leasing agent, maintenance provider, all those roles that have direct contact with our residents. Or perhaps you are joining us as a individual support provider, or as another phrase for that, I guess, is a service provider. So perhaps you are working with applicants and residents to affordable housing developments in the Commonwealth. So we welcome both sides of that coin. So Mass Housing has long believed and made a commitment to going beyond the bricks and mortar or the dollars and cents of the money that we lend out. And that focus has been primarily through the work of what was formerly known as the Community Services Department. We have now transitioned into the Housing Stability Department, and that is really just a reflection of our long commitment to ensuring that we are addressing the connection or the nexus or intersection of affordable housing and social issues, and with the understanding that those issues impact the stability of the overall community, but also the housing stability of individuals who are struggling with some of those issues, such as domestic violence, substance use or substance use disorder, mental health issues, issues related to aging, you name it. And we try to develop programming, put dollars in communities, as well as offer all of these trainings to support housing stability in both a macro and a micro level. So that is it for the Mass Housing spiel. For those of you who have been with us before throughout the year, we are not going to be issuing certificates of attendance, and therefore we do not need to deal with any of those pesky participation codes. So no worries on that. I'm going to skip that. And with that, I don't want to take up any more important time from this important topic. And so I will very quickly just let you know that we will be wrapping up content today by 11 a.m. So there's going to be a lot of time for questions and answers. And I will, from here, turn it over to Emily Cooper. So thanks for being with us today.
Thank you. Helena, can you hear me okay?
I can hear you okay.
Perfect. All right. Good morning, everybody. This is Emily Cooper, and I work at MassHealth. on issues related to housing and homelessness. And first off, I really want to thank Helena and Dave Ing and the folks at Mass Housing for making this happen. We really feel this is an important topic, and you all are on the front lines of working with people on Mass Health. And you see them, you house them, you work with them every day, and getting our message out to those folks through you all is really very important. So thank you to Mass Housing for bringing everybody together. And thank you all for spending time with us this morning. I, as I mentioned, am Emily Cooper. Just a little housekeeping. I think we have people in the background who are monitoring both the chat and the Q&A sections of the platform. So if you have questions, you can put them on there. If you have any tech issues, you should put them in there, definitely. We are going to stop periodically to also answer questions. So I'm going to present a lot of information and then stop and do some questions. Then we'll present some more information and stop and answer questions. So let me go ahead and share my screen. And when I do this, sometimes I can't see everybody. So holler if something's going on that I need to know about. So give me just a second. Oh, Helena, I need you to stop, or maybe I can just say that I took care of it. There we go. So can somebody tell me that they can see the screen?
You're good.
All right, I'm going to put this in slideshow if I can. Perfect. All right, so here today, we're really here to talk about MassHealth members and how to help them with their renewals. So let me first talk about what a member is, because we use that term a lot, and it's not a term that you probably use. When I think member, I think gym membership. So at MassHealth, anybody who is on MassHealth receiving health insurance through MassHealth, which is also the Medicaid program in Massachusetts, is considered a member. So we use that term a lot. And so just sort of want to acclimate to that. So Medicaid and MassHealth are the same thing. Member is someone receiving Medicaid or MassHealth. And you may have many residents or people that you're working with that receive MassHealth. So today we're going to talk a little bit about what MassHealth is. We're going to also spend time talking about the Health Connector. That's the second half of our presentation. And the Health Connector is affordable health insurance for people who don't qualify for MassHealth. So people who qualify for MassHealth is an income based on income usually. And so if you are over income for MassHealth, you're going to learn about other options. As we know, a lot of the people in your housing or that you work with may be eligible for MassHealth, but some people may have a slightly higher income. You know, maybe they're at 60% of the area median income, and they might qualify for other affordable housing options like Health Connector. So you're going to hear about that today. We're going to talk about what renewals are, what a MassHealth renewal is, why we're even talking about this. This is the first year we've ever done this, right? And so why is it important now? Talk a little bit about what you all can be doing to help people through their renewal process, and also talk about, as I mentioned, the Health Connector. So this presentation is for you all who are working in the community with people who interact with members. We're hoping to give you helpful tips and how to access basic assistance, but in no way are we saying you should become a MassHealth expert. We're not saying that you should ask for people's private information or access their accounts or do anything that is outside of your daily regular work. So there are specific MassHealth employees and agencies that have been sort of deputized, let's say, by MassHealth, called Certified Application Counselors, CACs, or navigators, CACs and NAVs, we sometimes call them, that can do those things. They are experts and they can help one-on-one. Your job today is to just learn about this, make sure everybody's informed about MassHealth and this renewal process, and get them to the right information if they need it, to the right person who can help them. So that is really what we're hoping you will do today. So a little bit about MassHealth. We have about 2.4 million people that receive insurance through MassHealth. That includes 220,000 older adults that we consider 65 and older, 300,000 people that are disabled, people living with disabilities, and about 67% are in families. MassHealth basically covers every 1 in 4 Massachusetts residents and every 2 in 5 children of all incomes. So, it's a pretty big program. We're going to talk about the Health Connector later today, but the Health Connector is what's known as the state health insurance marketplace. So it offers health insurance to people to individuals, families, and small employers to get affordable health insurance coverage when you don't qualify for MassHealth. So people who don't get health insurance through a job or other sources can apply. Many people who apply qualify for help paying, so it's subsidized in some ways. You can get dental insurance, and also if you're a small employer. So you're going to hear about that at the end of, after I talk, we're going to have folks from the Health Connector talk. So let's talk about MassHealth first. Federal law requires that MassHealth, Medicaid, every year, have somebody on Medicaid needs to complete paperwork, and that's called a renewal. And it basically says, similar to your housing recertifications, right? Every year, are you still eligible? Did anything change? That's what the process is. So every 12 months, each person goes through an annual review called a renewal. Sometimes you might hear it called a redetermination. And it requires usually paperwork and confirmation that nothing has changed, or tell us what has changed. And they occur every year. And the thing is that it happens mostly in almost completely through the mail. So renewals would, paperwork would be sent to the head of household. In some cases, we're able to automatically renew people because we use other state and federal data matching. So we don't send you anything, but if we can't do that, we will. If we don't have enough information, then we are going to send mail to you to renew your MassHealth coverage. And that happens every year, similar to your recertifying for housing that you do every year. So why are we talking about this year? This has been going on for years, right? That's the process. It's how it's been done. Why are we talking about this year? So as with many other things in life, COVID, public health emergency, changed the way we do business. And what happened was in February of 2020, when COVID sort of, we declared a federal emergency, we put protections in place. So from February 2020 until April 1 of 2023, nobody had to do any paperwork. We just assumed if you were on the program, you were on the program, and we kept you on the program. And then the Fed said to us, okay, the pandemic is over, public health emergency is over. You need to actually go through now the 2.2 or however many people we just said, 2.2 million people, and determine whether each person is actually still eligible for MassHealth. So that is what we have started now. So starting this past April, running for 12 months, we are looking at all 2.2 million people on MassHealth and trying to determine through different processes whether or not they are still eligible for MassHealth. And that is a big lift. This is happening in every state, so Massachusetts is not unique. We are working to automatically renew many people, as we suggested, but we're also doing a lot of mailing, and you're going to hear about the blue envelope. So over the next 12 months, or not 12 months because it started in April. So from April 2023 to April 2024, during that 12-month period, people will be getting blue envelopes and mailings from the government, and we want to make sure they don't ignore them. And that's where we're hoping you guys can help. Make sure people know this is important. We don't want anybody to lose their coverage that is eligible, and so that we want them to do their paperwork, and nobody likes paperwork. So and people say, oh, government, that's bad, just bad news, we're going to throw it out. We really, really need your help in making sure that people are getting this. Not everybody's going to receive it at the same time. So similar to your recertification for housing, it happens on an anniversary, maybe the lease date, right? If they leased up August 1st, then you're going to do recertification so that everything's in place by the next August 1st. So over these 12 months, people will be getting mailings at different times. Not everybody in your building is going to get mailing on the same day. It's going to be based on their date of enrollment into MassHealth. Just a note, as I mentioned, whenever possible, MassHealth is making every effort to automatically renew people. And there are people who will be automatically renewed because they sort of got their MassHealth insurance through a different door. So for example, if somebody is getting SSI from the Social Security Administration because they are 65 and older and they have limited income, or because they're disabled, they are a person with a disability and they have limited income, they won't be part of this process. If they're receiving TANF through DTA, they won't be part of this process. If they were in, currently or formerly in custody of DCF or DYS, they may not be part of this process. Don't assume that you will be automatically enrolled. The point is, if you get something in the mail from us, you must respond, because we haven't been able to automatically renew you. But generally, there may be some people that you're working with that you said, look for the blue envelope, and they said, I never got it. That's okay. It's because we were able to do things behind the scenes. One of the things that's very key to this is making sure that MassHealth also has your correct contact information. So we're going to talk about that as well, because if it's being done by mail and you moved, you probably didn't tell MassHealth. So we want to make sure that we're getting to that as well. Okay. So to that point, when continuous coverage was in place, MassHealth didn't redetermine anybody. So it's possible that something may have happened in these past 3 years that have impacted your eligibility. It's also possible that you have moved and we don't know that. So what's important is to call MassHealth, or I'll give you other options later, and the number's on the screen, but I'll say it now, 800-841-2900, and make sure to update your contact information. And that'll be done, automatically. We can take care of that right away. So I want to make sure that that's clear to people. Also, I will put in the chat, or maybe Toby or other folks from MassHealth, if they're on the line, can put in the chat the website where all of this information is, which is mass.gov/MassHealthRenew. That is the website where all things eligibility live, all things renewals live. So everything I've said will be on there as well. And I think Helena said this in the beginning, and I always forget to mention, the PowerPoint will be sent out, or has been sent out to everybody. So that will be available as well. So what can you guys do to help folks? Well, I think there's two things. One is help them prepare for renewals and help them understand how to complete the renewal. Again, you don't need to become an expert, but we'll tell you about ways that you can help if this is something that you're comfortable with. So first of all, let's start with helping them prepare for the renewals. Right now, you may have people waiting for their paperwork. If you can, as much as you can, as their trusted advisor, make sure they are keeping an eye out for that. So for example, tell them, if you're talking to people, tell them to give MassHealth their phone number and email address if they have one, because we're communicating that way as well. Remind them to check locations where they may have had mail sent in the past if they haven't updated their address or they've moved since 2020. Post flyers, and their flyers online that we've already created a whole toolkit. Post flyers, let people know about that this is happening. Look yourself, you may have a mail room. If you see a blue envelope and you're a resident service coordinator and it's in Joe's box, maybe stop by and say, hey, Joe, don't ignore this. This is really important. And, what can I do to help you with this? So post the flyers, have them update their information, make sure it's an address where mail can be sent safely. If they have all their mail being sent to their mother's address, make sure their mother isn't throwing out the blue envelope. If it's not a blue envelope, they may also get a white envelope from MassHealth or from the Commonwealth of Massachusetts. Anything that looks like it's from government, they should pay attention to and open, because it might be something from us right now. Let's see here. So how do you update your information? The best thing to do is to call the customer service line, and I promise they won't be on the phone for hours and hours and hours. we are managing the customer service line, and it is going well right now. There's also things called the virtual hold, which is you can put your, you sort of say, do you want to call back? So you can, if they say, oh, there is a long wait, I'd like a call back, then you can do that and they will call you back as soon as they're available. So that's really quite helpful. This is the big blue envelope. So it won't say it's from MassHealth. It won't say, you know, anything about MassHealth on it. It's the Commonwealth of Massachusetts. So this is what you look for, you know, big blue envelope, I can't say it enough, right? But also, you also want to tell people to look for white envelope or other mail that could be from MassHealth. So once you get the blue envelope, you may send it in, but there might also be a request for information or verification or something that comes as a result, and those are going to arrive in white envelope. So, you know, even though we're saying big blue envelope, pay attention, my message is pay attention to all the mail right now. And again, this is, you know, I'm just speaking from personal experience. I might take some of this mail and, you know, put it aside. It's not interested. It's not fun. It's not sexy. It's not saying I won $1 million. So it's not something I'm really eager to work on or to look at or even open up right away. But as we'll go through, there are some time and deadline issues to think about. So it is important not only that they open the mail, but they, you know, look at it and it doesn't sit there for a little while. So if for some reason you can sit and wait for the blue envelope, but if for some reason you are in a situation, so for example, there are lots of redetermination, MassHealth renewal events going on. We have things going on at senior centers and at councils on aging and other places in the community. And if one of your residents shows up in one of those places, they will get help with their MassHealth eligibility. They don't have to wait for a blue envelope. They don't have to, you know, wait until it's their anniversary date or that it's their renewal date. They basically will wind up if their renewal date isn't until October and they go to an event in August and they take care of everything, we're just going to move their renewal clock to August from October, which is not a big deal. So my point is look for the blue envelopes, but if there's an event in the community and you go, they can get it fixed there, then don't worry, you know, if you haven't gotten a blue envelope because we've taken care of it. We actually kind of, you know, would suggest that if you know of events going on, that people go to those because it isn't as dependent on the blue envelope. It isn't as dependent on the mail. It'll reduce the number of people who are losing coverage because they don't respond. So we are really that's why we're out in the community trying to have these events. Again, updating your contact information is the best and easiest thing you can do. Right now, MassHealth is 800-841-2900. Okay, so you've told everybody, look for the blue envelope. You've put up flyers, you've done all these things, and oh, got the blue envelope. Now what the heck do I do, right? So some blue envelopes will include applications that are pre-populated, and you just need to, you know, look at it, see if anything changed, make those changes and sign it and send it back in. Some, particularly for people who are 65 and older, won't be pre-populated and they'll be longer and they'll have to include more information. So it would be helpful if you, in your working with people, like if you know somebody is vision impaired, that they're going to need help reading with them what they have in front of them, if there's translation services. Now, again, we have a lot of that online already. We're going to be sending this out. We have it available in other we have resources that can help with this, and we have things available in other languages. However, what's being sent to them is probably in the language that we have on file for them. And if that's not correct, they're going to wind up with something that they're not able to use. Working with them to think about what they have to do and when they have to do it by. When they complete this renewal, it can be in paper, and they can send back the information in an envelope and we'll send it right back, or they can do things online. And we'll talk about that in a second. So there are a variety of options for completing the renewal once you get the blue envelope, but working with a person to just say, what is your plan and how can I get you the assistance that you need? So we'll include, I'm going to go over some of those, but there are things called the MassHealth Enrollment Centers, or MECs, certified application counselors I mentioned before, CACs and navigators, and there's the MassHealth Customer Service Center. So if all of this sounds like, oh my gosh, I don't know anything about MassHealth, and this woman is talking to me and it's sounding like Charlie Brown's parents, and this is more than we don't do this. I'm the maintenance guy and I fix things. I don't know anything about MassHealth. Then at a minimum, we just ask that you just give them the information or post somewhere, here is where you can go for resources. Actually, I'm going to just skip ahead for 1 second, then I'll go back. So these resources include the MassHealth Enrollment Centers. The MassHealth Enrollment Centers, also known as MECs, they provide members with help, phone and or virtual or or in person with their actual MassHealth staff. We recommend if you go to a MEC that you schedule an appointment ahead of time, and there's a link online, and those appointments can be via phone, virtual, or in person. And there are 7 MECs across the state, and there's a link to find the nearest one. We also have, as I mentioned, deputized a whole bunch of agencies and people that are known as CACs and navigators, and they are community-based agencies that are now able to help people renew health insurance rates. They are trained by MassHealth, but they are not MassHealth staff. And so they can help in many ways, and it's free. All of this is free. So getting help from a CAC or a navigator is free, but it can require an appointment. And you can go online to find the nearest organization that is a CAC or a navigator in your community. If, just as an aside, if you all, anybody on the phone here is interested in becoming a certified application counselor agency, that is something that we are always encouraging people to do. And again, you're not paid, but you are trained by MassHealth, and then you can help people with their applications for MassHealth, and you're knowledgeable and can get into the system. So we're always looking for more CACs in the community. And then finally, if you have questions, there's a MassHealth Customer Service Center. I've plugged the phone number, but it is available Monday through Friday, 8 to 5. Assistance is available in a variety of languages. And if we don't have the staff with that language, we can get a translator for other languages. So if somebody comes to you, they've gotten their blue envelope, and you don't know anything about MassHealth, then that's totally fine. Get them to one of these places. Help them arrange for an appointment virtually, in person, wherever it is, with one of these people or one of these places, so that we can get the application done and fixed and all set and not anything to worry about. So what is it that people need to do to get renewed? So it varies depending on if you are under 65 or over 65. So people who are under 65, once they get their blue envelope and they want to do this, they can actually go online. This is the easiest way to do it. And you could do it actually now. You don't have to wait for the blue envelope. You go online, you create an account, and you go through the whole process. They will, when they get the blue envelope, get an individualized link. But if they haven't gotten their blue envelope and they want to do it now, you can, help them right now. One thing, I know some of you guys are resident service coordinators. You can have a computer session in your computer room if you happen to have one, one day, and let's everybody renew their MassHealth. And that's what we can do today. You can help them complete the paper application and mail it in. You can have them call customer service, and they will do the whole application with them online, on the phone. Or as I mentioned, you can help them schedule an appointment with a MassHealth representative, and there's a scheduling tool. Once you get the blue envelope, you have 45 calendar days to fill it out and send it back to MassHealth, or do one of these things. We're going to talk about the timeline in a second. So it's a little bit different for people over 65, whether they're in the community or someplace else. And you're going to have sort of different things that you go through. You can creating an application for the first time to complete your application online. You can, if they got something in the mail that's a renewal, they can do a e-submission also online. You can print out what they have and mail it in, or they can call customer service or schedule an appointment. So they have a little bit of a different website to go through. And frankly, a little bit more information is needed on the application, and that's why it takes a little bit longer to do. Oh, hold on. Here we go. All right, let's talk about that timeline for a sec. So as I mentioned, we're going to try as much as possible to automatically renew people's coverage. You may get a letter saying that we have updated information based on a trusted source, and you're all set. If there's something to do in that letter that you're supposed to respond, then do that. But we are trying whenever possible to automatically renew people. If you get a blue envelope, you have 45 days to respond. So that means if we can't automatically process something, we're going to send you a blue envelope. You have 45 calendar days, not business days. That's important to note. You send it in, but you know what? We still need some more information. So we might send you something in a white envelope called a request for information, which says, hey, we need a little additional documentation. So you're going to have an additional 90 days to respond to that. If for some reason it turns out that we say, you know what, given the information you've given us, or you've been, given the information you've given us, it doesn't look like you're eligible anymore, we will send a termination notice. You have typically at least 14 days after getting that notice before your benefits will stop. We will then also have a renewal reconsideration period of 90 days if for some reason we close the case because you didn't respond, and then you're like, wait, I never got that mail, and please reconsider. There is a process by which we can look at the application again. Okay, so online, I mentioned we have a variety of resources. There's a whole renewal guide. Again, you don't need to become experts. You don't need to look at this. If you remember anything from anything I said today, is tell people to look for the blue envelope and then get them to the right people for help. This is the website, mass.gov, MassHealth Renew. Everything I've said is there, along with all sorts of tools and infographics and toolkits and webinars that have been held for different groups. So lots of information on there if you do want to dive in. Other ways that you might want to help, if this piqued your interest and you really want to get involved, there is, you can sign up for our email list for redeterminations. You can join what's called the Massachusetts Healthcare Training Forum, which gives out information about MassHealth policies and operations and other things to healthcare organizations and community-based organizations. And you can join the email list or go on their website. Or as I mentioned, your agency can consider becoming CAC, which is a program where your agency says, I want to be part of the CAC program, and they sign up with us. It's a voluntary program, so nobody pays for the help they get from a CAC, and CACs don't get paid for delivering the help. But once you become a CAC, once your agency is authorized CAC, then staff can become trained to help people with their MassHealth applications and insurance. Okay, so I'm actually not going to talk that much about this slide because we're going to hear from the Health Connector in just a few minutes. But this is basically, kind of what options, what would happen if somebody loses their coverage and what else is available to them. And we're going to hear from the Health Connector, and they're going to tell you everything about that. So final tips: if members are under 65, if they, the best thing to do is to have them go online and create a MassHealth account and renew their coverage there. Or they can go online if they're 65 or older and find out what the options is there. Remind people to call MassHealth to update their contact information because we're doing everything by mail. They may have to wait, but they can use that virtual hold to get a call back on the customer service line. They may already be getting their forms because it started in April and it's going to go into the next April. So please, have them be on the lookout for it, and please use the resources available and direct them to those resources. And because you guys are invaluable, you are we know that you're the people in the buildings who are making sure that they're going to come to you with the question before they ever come to us. So we really appreciate your help. Okay, I'm going to stop sharing my screen for 1 sec because I see a lot in the chat and the Q&A that I haven't looked at. So Toby or others, do you want to take any questions now?
Emily, it looks like Toby and Nikki have been doing a great job in terms of answering questions that have been coming in through the chat, but there are a few that I think are remaining. So I'm just going to read them out loud, and Toby, Nikki, Emily, if you guys want to jump in to answer them. The first is, if someone is in shelter or undocumented, will they be receiving documents?
So I'll start with the shelter situations, the shelter question part of it. We are actively partnering the Department of Housing and Community Development to help out families who are in experiencing homelessness and in the EA shelter system, as well as individuals experiencing homelessness who are in individual shelter. So for the families, we have a data sharing agreement. We have updated addresses for everybody, and we are working with the EA shelter providers to do similar things like this, make sure their blue envelopes, they're getting it, because people stay in EA for quite a while, we're able to find them. People in individual shelters move around a lot more. We don't have address information, isn't going to be as helpful. So we are actually launched just last month on-site events in individual shelters across the state that are interested in having them, where we take care of everything that the person needs for when they sit down with us. We're bringing the MassHealth work to the shelters. So for example, last week I was in Lowell and we helped 30 or so people who came and met with us, and we did soup to nuts, whatever they needed, even if they were perfectly fine and just needed an address card or something like that. Or it's not an address, excuse me, a MassHealth ID card. The question about undocumented, I'm going to punt to one of my other colleagues. They don't see them.
I'm trying to.
There you are, Toby.
I'm trying to see the text of the question. I can't see it in the Q&A box. Would you mind repeating it potentially?
Sure, Toby. The question is, if someone is undocumented, will they be receiving documents?
So I think if you are a MassHealth, you may be receiving what's called MassHealth Limited, which is often for people who are undocumented. So if you are on MassHealth coverage, you will be receiving something, right? So if you currently receive MassHealth, you will get something whether you're undocumented or documented, because everybody is getting asked to reconfirm their information. And if something has changed in your documentation status, that's a great time to let us know. Dave, are there other questions?
There are other questions. So this one I think is about the automatic re-enrollment. Someone asked, would that include members who receive SNAP or just those receiving cash assistance?
So I think the question is, we are automatically renewing people who get TANF through DTA also then wind up getting MassHealth at the same time when they apply. So they're getting renewed through a different process. So I think the question was, when people receive SNAP benefits, do they also automatically get MassHealth and are renewed separately? And that's the question. I'm not sure if we have an answer, but we can get back to you. Toby looks like he is going to answer.
Yeah, apologies, my connection cut out. I think it really varies from member to member who gets sort of automatically renewed. So we would just encourage folks to keep an eye out on their mail, and if in doubt, call MassHealth. MassHealth will be able to tell you if you are in a renewal period, and that whether you take action.
Yeah. Mm-hmm.
So I see a question in the chat. I don't know if this was answered, but if they don't receive an envelope and they're worried, can they call? To Toby's point is, When in doubt, Kala.
All we can do, we have to do it. It has to go back. Yep.
Okay. So when in doubt, Kala, we will definitely, that's the best thing to do.
Another question in the
Yep, go ahead.
Another question in the chat is, are there groups or agencies that can help non-readers?
Yes, I just don't have that. We have a slide all about people, but I don't think it's in here. Toby, you have an answer?
Yeah, I mean, I think just to make sure I'm understanding the question, if by non-readers you mean folks, so I think folks can call the call center. The call center is usually the best resource for the most up-to-date information related to your case. And if it's a case where folks aren't as comfortable speaking or reading English, the call center also has translation options available. The first message you hear when you call should say something like press 1 for English, and then in the top 7 languages I think that MassHealth members speak should have an option to press a number for that language spoken in that language. And if you stay on the line or press 9, or maybe it's 0, I can't remember exactly, you get an option to speak to someone who can find you any other translator that person might need. So I think the call center is the best resource for those that are not reading or that struggle with reading English.
Great, thank you, Toby. Another question is there a web page with a list of events where people can get assistance?
Go ahead, Debbie.
So at this point, I think we would direct folks to, Emily shared a slide that had sort of the different resources that folks could go to. So we would direct folks to look to try and schedule appointments or walk into a MassHealth Enrollment Center or a MEC, or to look up where they might have assisters or CACs in their area that they can go to for help. At this time, we don't have a publicized list of other events that MassHealth is hoping to do in the community. Those are still in development, and will be fairly small and focused around homeless shelters, individual shelters, and senior centers primarily. So I would encourage folks in the near term to look for the MEC and CAC resources.
Looks like there's a follow-up question to that. Someone may be interested in setting up an event perhaps at their site.
Yeah, I'm going to put an email address in the chat that folks, if folks are
and I see it's from Michelle at AgeSpan. We can talk as well. AgeSpan being an aging service access point agency, we can talk about events that are going on as well. But Toby's going to put a link. I mean, an email. You said.
Yeah, I mean, I believe. Hi, Michelle. I believe we're already working with AgeSpan to.
I think so too.
Set a number of events, but we can't commit to anything. But we're always open to ideas and partnerships with the community to try and meet members where they are and help folks that need the help.
Thanks. So there's a couple follow-up questions to the earlier question about the non-readers. So one person asks, or perhaps just notes that they have folks who speak English, but read at a very low grade level. And also they have folks who don't speak English and also cannot read in their native language.
Call the helpline. We will walk you through the whole application on the phone in whatever language, and you won't have to read anything. So that's the message, I think.
Great.
Dave, if there are not a ton more questions, I want to give the Health Connector folks a chance to talk, and then we can do questions again at the end.
Sure. There are a few questions in the Q&As, but perhaps.
Okay, I'll take a look at those.
Yeah, if you could take a look at those while Toby or Nikki are going with the next section.
That's great. Thank you. So I'm going to turn it over to the Health Connector folks. And do you need me to share my screen still?
Yes.
Or?
Yes, please.
Okay. All right, then let me go ahead and do that. I'm going to.
Hi, everyone. While Emily's doing that, just again, a big thank you for taking time out of your day to join us for this really important information. So Emily explained that, you know, some people as they go through this process may not in fact still qualify to be able to keep their MassHealth coverage. So we want to talk to you a little bit more about how someone could get coverage through the Health Connector. So going on to the next slide, Emily had mentioned at the very beginning when she was kind of doing a level set about, you know, what MassHealth offers and who the connector is and what we offer. The Health Connector really is here to offer coverage to anyone who doesn't have access to it from any other form. And you may be thinking, okay, isn't MassHealth and the MassHealth Connector the same thing? And we are separate agencies. However, we do work really, really closely together, as you can see right now. And so if somebody loses access to MassHealth coverage, basically what's going to allow them to get into Health Connector coverage is the fact that losing MassHealth coverage is considered a qualifying life event. It opens up what's known as a special enrollment window, a special enrollment period, and that basically lets somebody who doesn't have access to health insurance coverage come in outside our typical enrollment cycle, our open enrollment cycle, and they can get health insurance coverage. Now, so if you're like kind of going back a step and thinking not only just about folks who are going through the MassHealth renewal process and maybe losing their MassHealth coverage, but anyone else who you may be talking with that, you know, needs health insurance coverage. So if it's outside of our open enrollment, things like, you know, changes in their household size, their income going up or down, changes in immigration status, or even moving within Massachusetts or moving to Massachusetts. Things like this are all reasons why someone would qualify to apply for coverage and get into Health Connector coverage outside of open enrollment. So all we really ask of folks is to, you know, if they know a qualifying event is about to happen or after it's happened, really just report that event as soon as possible. There are a number of programs for the Health Connector, and I'll describe those, but some people may need to pay a monthly premium for their coverage. So even though we're in this like special enrollment period, they're going to need to follow the other rules. So follow the enrollment deadline rules as well as payment options to get into coverage. So going on to the next slide, you know, we've talked about folks losing access to MassHealth coverage, but there may be people who are losing MassHealth, but they are working. So I think one of the questions we may need to ask folks when you're talking with them is, you know, are they eligible for benefits through their employer? And if they're not sure, we really need to encourage people to reach out to their human resources or their benefits department to find out. And so some of the questions may be, are you eligible for benefits not only for yourself, but are you eligible for benefits for your family? And if they say, you know, yes, you are, the person really should find out the cost of those plans, how much the employee is going to need to contribute to be able to enroll in those plans. And of course, when does the employee need to make a final decision by to enroll in that employer-sponsored health insurance coverage? Because one of the things we really want to do here is try to help people not have any gaps in coverage. So we don't want them to spend a long time without access to healthcare, without access to their medications, et cetera. So you may find that some people say, yes, it turns out I am eligible for my employer-sponsored insurance, but you know what? It's not affordable to me. So if that is the case, that's when the person really is going to need to just collect a little bit more information from their employer, and they can apply through the Health Connector, and they may be able to get access to some subsidized health insurance coverage. So we'll talk about that. But essentially, and Emily mentioned this, we have one application for both MassHealth and the Health Connector. And all of the questions that are on the paper application are also on the online application. And as the consumer is going through either the online application or the paper application, they're going to have an opportunity to add this level of detail in there so that we can see whether or not they and their family can in fact get the savings through the Health Connector. So going on to the next slide, I want to talk a little bit about the types of savings and the types of plans that somebody could access if they come through the Health Connector. So we have a couple of different types of, or a couple of different ways that we subsidize or help make the health insurance plans more affordable for people. One of them is through our state's Connector Care program. And this is a really great health insurance coverage option. And the way in which we're able to offer it at such a low cost is it combines federal subsidies that the person is eligible for, along with additional state dollars. And that's how we're able to offer the low monthly premiums and low cost sharing if someone goes to pick up medications or go to a visit. And then people who may find that they're over income for the Connector Care program, they might still be eligible for these federal tax credits. And that also lowers the premium amount for people. So when you're thinking about the Connector Care program is organized into plan types. And it goes by, if somebody is eligible for the Connector Care program, it goes by the federal poverty level, their income level. And it's essentially like a sliding scale. So somebody could choose to enroll in the plan. If they're on the lower end, they could choose to enroll in a $0 plan. And as they are moving up in plan type, they have the option of enrolling in the lowest cost plan in that category. Now, we've talked about something that might not seem familiar to you. So we've talked about federal tax credits. We've talked about these subsidies. I think what's really important just to know or have in the back of your mind is that if someone is eligible for these federal tax credits, those dollars go directly to the health insurance carrier that the person chooses to enroll into. The consumer, the person who's becoming the new member, simply pays the lower amount. So they don't have to manage and juggle that. They just have to pay the premium for the plan that they choose to enroll in. And also people can rest assured that any plan that they enroll in through the Health Connector is offering comprehensive benefits, and they meet state and federal coverage standards. So they are good plans. So going on to the next slide, just a couple of, I think, reminders. When you're thinking about, who might be transitioning over to the Health Connector. So, these are simply just estimates, but we're thinking that based on the number of people who have been protected in MassHealth, we may expect to see 100 to 200,000 people move into the Health Connector coming from this MassHealth renewals process. So you may be thinking, okay, so what do people really need to do? And this is going back to what Emily said. The very, very first thing someone should do is review their eligibility. So we share the same application at mahealthconnector.org. Someone can call customer service. Someone can also visit a certified application counselor. That's one of the resources that Emily described, or a local navigator to see what coverage they qualify for and what kind of savings they can receive. Enrolling into coverage in the Health Connector is slightly different than in MassHealth. So similarly, someone wants to compare insurance plans, but they are going to be set up slightly differently. They are going to need to do this on the Health Connector website. And someone can, in fact, do this on their own, or again, with free help from an enrollment assister. And somebody who is a current MassHealth member may want to make sure that the doctors and the medications that they're currently taking are also in the plans that they're going to enroll into. So we have a number of tools on our website which would let them do that. And also the assisters, or even calling customer service, those folks there can help somebody use those tools and make sure that they're enrolling into the plan that they want and need. Now, going on to step 3, actually enrolling in a plan. We want people to choose the best plan for them. So something that's going to meet their healthcare needs, also their household budget. So when it is time to enroll, they can do that online. They can do that by phone. And we really want to, again, encourage people to do that before MassHealth ends. Now, in terms of deadlines, I briefly mentioned that, deadlines do apply. One of the ways in which Health Connector coverage is different from MassHealth coverage is that Health Connector coverage begins on the first day of each month. And then if somebody needs to choose a plan or pay for a plan that they want to enroll in, all of that needs to be done by the 23rd of each month. So, if they need to make a payment, if they need to, if they're still trying to pick, it has to happen by the 23rd. So if we're looking at July here, somebody would have a few more days so that their coverage could be effective on August 1st. So going on to the next slide. And I think we just have a little slide delay. Here we go. So I've said a couple of times here, and we have mentioned this website, but again, this is an application for individuals and families. And typically the people who use this application, or excuse me, typically those who complete this application are those who are under 65 years of age. There are examples of some people who don't qualify for Medicare who might use this application. But typically those who are under 65 are going through this application. And this is one application for Health Connector and MassHealth. And we're happy to say that this application is available in English as well as Spanish, and the websites are listed there. But really, really important. And again, we realize that you're helping people at a variety of levels in each of your positions. So if you're talking to someone and they say, oh, I got to go in, I got to create a new account now, please say no, you don't. If you have, if you have MassHealth coverage, you already have an application. So if someone has forgotten their username or password, or maybe never even had a username or password, they can call customer service and get access to their online application. We really don't want people completing new applications, but rather updating their old applications with their most up-to-date information. So going on to the next slide. Again, we just keep reinforcing, like, where can someone get help enrolling? So again, free assistance is available. And the great thing about this free assistance, you've heard Emily talk about MassHealth customer service, the MEX. The Health Connector also has customer service, different telephone number listed here, but we use the same community partners. We have trained navigators, trained certified application counselors. Many of these folks speak multiple languages, and they can help someone from application, updating their application into enrollment into a health insurance plan. So these folks are really great people. If someone is having, difficulty, I think folks were talking about, non-readers, and it's like, well, how can we help folks, as they're struggling to kind of go through these, this mail that they're receiving for this important benefit. We have navigators who have established long-term relationships with clients and MassHealth members or Health Connector members, and they are there in the community to help people for whatever reason they may need assistance. So in terms of finding somebody who can provide support in your language or maybe in your community, you want to click on get free help near me or free help near you, excuse me, and you can enter a zip code and then see the organizations that come up. And then you can also see what languages those organizations speak. For the Navigator grantees, I know we've listed languages, and I believe for the certified application counselors, those are being updated each day. So really want to encourage you to get familiar with the resources that are available in your community, so that as people ask you for more detailed assistance, you know exactly who you can send them to. And now if you go on to the next slide, just a couple of key takeaways. You know, the primary reason we wanted to be here today is so that all of you had an understanding about the MassHealth renewals process. And we're here today from the Health Connector just to ensure that you know that we are an option for people if they need coverage for themselves, their families. Separately, we have a program for small employers, but you don't need to worry about that now. If you're interested in learning more about that, we host a number of webinars on that each year, and you can find all that information on the Health Connector's website or even on Eventbrite. But really, this is about people who have lost access to MassHealth coverage. They can, in fact, enroll through the Health Connector. Really, the first step is updating their application to find out what, in fact, they're eligible for. If they are eligible for a Health Connector plan, you know, what that is, what their savings may be. And if, again, if they need the coverage, really, we want them to try to get in before their MassHealth coverage ends. So again, in this example, our enrollment deadline is the 23rd of every month. So if you're needing coverage for August 1st, everything needs to be completed by July 23rd. Again, people can do a lot of this work online, over the phone with customer service, with the help of an assister. So please encourage people to call ahead, make an appointment, and many, many people are there to help them. So I'm happy to take any questions that may have popped up. I'm sorry I wasn't following along in the chat or the Q&A.
Nikki, I can read some of the questions to you.
Okay, great, thank you.
So there's a question about whether the Health Connector plans, the income is based on the previous year. The person writes that they had a resident who chose a Health Connector plan, and then after they filed their tax return, they were found to be not eligible, and they were fined. So they're wondering if that is, should that have happened? Why does it happen?
Yep, I'm happy to explain that. So when somebody is completing an application, whether for MassHealth or the Health Connector, they're asked about income, but they're asked about income in two ways. They're asked about what they're currently making, and then they're also asked to project their income for the current year, like the calendar year. And then what happens at the end of the calendar year, let's say, for example, somebody was eligible for those tax credits that I mentioned. At the end of the year, the person goes and files their taxes. And what happens, just like any other tax credit, is the person is going to need to reconcile those tax credits. And some people, if they have underestimated what their income was going to be for that year, may need to pay some of those federal dollars back. On the flip side, if someone has overestimated, they may actually get tax credits back in their wallet. So we really try to encourage people to do the best that they can when they're trying to calculate what their income is going to be for the whole year. No one really has a crystal ball. So we say, okay, do the best you can, project the income, you know, give your best guesstimate. But then if something changes, if you get a job, if your salary goes up unexpectedly, or it goes up because let's say you're in a busier season, do come back to the application and increase your income, have it reflect what it really is, so that you don't have any surprises at tax time. So it's not necessarily a fine, but rather dollars owed back to federal dollars owed back.
Great, thank you.
Yeah.
Another question is, we have residents who have Medicare and are not eligible for MassHealth Standard, and they buy in to a Medicare Advantage plan. Can they apply to the connector and receive tax credits?
Yeah, unfortunately, if someone is enrolled in Medicare, if somebody is eligible for Medicare and takes the Medicare coverage, they cannot buy any like supplemental plan through the Health Connector. So they need to go to the standard Medicare, the supplemental carriers. I mentioned that sometimes people who are over 65 who maybe don't have enough credits to be eligible for Medicare. Sometimes those folks do come to us. And again, it's because they're not eligible or enrolled in Medicare. And that's why those over 65 can in fact sometimes get coverage with us.
Great, thank you. Another question, this might be connector related or maybe generally general MassHealth question. For a married couple, is one spouse listed as the main person who's enrolled? Because if a spouse dies who is listed as the main person, does this affect the surviving spouse regarding MassHealth or Health Connector coverage?
So maybe Emily and I can take this together because I feel like there are some facts that I want to convey from the Health Connector side. And then I'm sure, Emily, you're probably looking at this from another perspective. But one thing I've heard from the assisters over time is that when they're completing an application, they try to encourage people to put the head of household as the person who's going to make the phone calls, who is going to, if they need to do any follow-up, because basically customer service is only allowed to speak to the head of household. And the other thing that sisters have told me is if there is a couple and one person is older than the other, they like to put the person who's younger as the head of household because if somebody as they're aging, if the other person rolls off and is eligible for Medicare, it just makes their lives easier because they just remove the Medicare eligible person. So Emily, those are just two little tidbits that people have shared with us over time. I don't think there's a requirement.
Yeah, I don't think there's a requirement. I think though, if you have somebody who is in a couple, you want to make sure if one has passed away that you've notified your insurance plan. And if that's MassHealth, you're going to want to notify them and they're going to recalculate and redo everything based on who's left in the household. So I would, again, call customer service, work with a CAC. You're going to start from scratch. Now, even though there's this head of household concept, this gets to a question a little bit later, I think. MassHealth does look at each individual member separately when thinking about eligibility. So you may have one person who's on the connector and one person who's on MassHealth. This happens a lot for families with minor children, for example. Toby, I don't know if you want to add anything to that.
No, nothing to add. I think every situation is going to be slightly different. And so we just encourage people to call the customer service center or schedule appointments at member enrollment centers or with navigators to get tailored advice respective to folks' individual situations.
Great, thank you for the tag teaming on that. Another question about the connector. Have the requirements changed for people who have insurance through the connector?
In terms of requirements, I mean, we have a set of eligibility requirements. Maybe what the person might be getting to is fairly recently through different legislation, we've been able to expand the amount of subsidy that we're able to give. So as an example, Premium tax credits are now available to more people because there actually isn't an income limit on premium tax credits. It's rather based on affordability of plans for that person's household. So the calculation is, the person or the household shouldn't be paying more than 8.5% of their total household income for health insurance coverage. And there are subsidies that will help soften that so that the person can get something that's affordable. You don't have to worry about figuring that out. It basically, we just need the person to enter all their information into the application, and the system will do the calculations and determine if they're eligible for expanded subsidies. But that's the only, change that I can think of. I have some colleagues in the wings, so I don't, if there's something anyone else wants to add in, or if the person wants to add some more clarifying information.
No, Nikki, I think I was racking my brain as well, but I think that you covered it. But good question.
Another question that's in the chat. I had an individual who is the head of household, and they bought a plan through the connector, I'm assuming, but the rest of the family got full MassHealth at no cost. Is that normal?
It can happen. It can happen. So as Emily was saying, we are looking at the entire, household, and you may have family members who get MassHealth coverage for a variety of reasons. And then another person is on a Health Connector plan.
Dave, before you move on to the next question, there seems to be some questions. I just want to add some background information. So MassHealth has a variety of different types of coverage, and they have different fund names: MassHealth Limited, Health Safety Network, Premium, Family Assistance, Standard, Care Plus. Those are all MassHealth types. Like, we've looked at your situation and determined, yes, you are eligible for MassHealth, but because of something going on in your situation about, whether you're have a disability or your age or your income or something like that, we give you a certain flavor of MassHealth. The Health Connector is for people who are not on MassHealth at all, right? You can't qualify for MassHealth at all. So here's another option for you that's affordable. So there's some questions about, people not eligible for MassHealth Standard or people eligible for Premium and gets denied. So there are different types of MassHealth. I think the key thing is this person eligible for any kind of MassHealth? And if they're not, then the Health Connector is a good option. I hope that helps with some of that.
Thanks for that. There's a question, I think someone's looking for maybe a little bit of advice. A college graduated person looking for a job, should that person apply for MassHealth or look for insurance on the connector?
So I kind of want to go back to something that Emily said. So in terms of being eligible for Health Connector plans, a person would need to not have access to insurance from any other source. So if they're a recent college graduate, I think the first question would be, okay, is there any chance you can get health insurance through a parent? The rule is that up to age 26, they can in fact access coverage. People can in fact access coverage through a parent. That's not always the case. That is not always possible for everyone. So if someone is, doesn't have a job, doesn't have access to insurance, they're legally here in Massachusetts, absolutely. Put in an application. The great thing is that someone doesn't need to know exactly what they're applying for. The online application at mahealthconnector.org is that same application for both MassHealth and the Health Connector. Person's going to enter all their information, and based on their unique situation, they will find out what in fact they qualify for. It could be MassHealth, that could be the Health Connector. We don't really know.
One-stop shopping. That's great.
Yeah.
So I assume, so there was a question that just popped up in the chat, and I think your answer is probably going to be the same, but if a person has no income, what are their options?
Same thing, I would say, come to myhealthconnector.org and based on someone's it's really not just income, it's also it's immigration status. We'd be looking at kind of the whole person, and then make a determination. Not we, actually, the system will make a determination as to what it is in fact they're eligible for.
And this is a question, so this may not be about the connector. So I have a participant who has changed providers. The person received a letter saying that they now have Steward, but received BMC Health. What do they need to do?
I would call customer service at MassHealth. Sorry, MassHealth customer service. They'll straighten it out and get you the right cards, and make sure that your provider, meaning your doctor or whatever, is in the right plan so that you don't have to. We did move things around in April, so that may have complicated things.
I think the person who asked the question about Medicare buy-in, I think they were looking for clarification. Is that person not eligible for anything on the connector?
You know, I'm glad you asked the question again, because I always forget about this and I shouldn't. My colleagues are probably saying, yes, we have to always say this. A lot of people who enroll in Medicare, are enrolled in Medicare, do buy dental coverage from us. That is allowed. So that is the only thing someone who is eligible for Medicare can buy through the Health Connector.
Thank you. I think that we have gone through all the questions in the chat and in the Q&A. I think I would ask if anyone has a question that wasn't answered, or they would rather ask it live rather than in the chat. Feel free to unmute yourself right now and ask a question.
I had a question as far as with the Health Connector, that you have local navigators that you can go in person to.
Yes, that's right. And I'm going to ask if one of our colleagues can post the link in the chat. I know we have links in the presentation, but they're embedded. So when you go to the website, basically all you need to do is enter a zip code, or even you can enter, I think, a street address too, or something. And both navigators and CA certified application counselors are listed there, and either of those groups of folks can help you. And the great thing
is that in person or just on the phone?
They can do both. It's really going to be your preference.
And Nikki, to interrupt you, they can help you with your MassHealth and your connector.
Yes, thank you. They can help with whatever the person needs.
Okay, thank you.
There is another question, sorry, in the Q&A, although this may have been answered. If someone applied for MassHealth Premium and they were denied, are there other options?
I think the person, did it say premium assistance?
It did, yes.
Okay. So my understanding is that premium assistance, Emily, do you want me to just at least, okay. My understanding is that premium assistance is for a person who has access to employer-sponsored insurance. And then they're applying for premium assistance to help offset that employer premium, so that they would be contributing less or getting some assistance paying to that for that employer-sponsored coverage. I think I would call, if they were denied, I would call, there's a whole separate premium assistance line. I would contact them and just talk to them and understand why. and then ask if there were any other options. That person could certainly apply on mahealthconnector.org if they feel that their employer-sponsored insurance is not affordable to them. I briefly mentioned this, but there's detailed information they need to collect from their employer, and then they have to enter all that information into the application. Because, you know, there are people obviously who have access to ESI, but it is not affordable to them based on their job, the income that they're making from that company.
And it looks like there's a follow-up to that, premium assistance to help offset the cost of care for a disabled child.
That I cannot speak to. I don't know, Emily or Toby, if you can speak to that. I'm not aware of. I'm not aware of that program.
My eligibility knowledge doesn't quite extend to that level of detail, but again, would encourage folks to reach out to navigators or reach out to call center, reach out to member enrollment centers to kind of go through the specifics of individual cases.
Great, thank you. Anyone else would like to ask a question? Hearing none. Thank you very much to all of our participants this morning's session. As we said earlier, the slides have been shared in the chats. I think Helena emailed them to everyone who registered during the webinar. Our recording we will post on our YouTube channel, and we will send the link to that to everyone who is enrolled, who signed up for this webinar, and we may try to post that in some other places as well so that folks can find it. Thank you to our friends Emily, Nikki, Toby for sharing all this really important information. Before we say goodbye, any final thoughts from any of our presenters?
No, I just wanted to thank you guys at Mass Housing for putting this together. And I really want to also thank everybody on the call, the 200 or so people that took the time with us this morning. We recognize that you guys, particularly the resident service coordinators and the property managers, you are working with the MassHealth members and people in need of affordable health insurance on a daily basis. And you, not only are you working with them, that you're who they trust, right? They're coming to you for advice. They're coming to you for questions. And so we really see your vital role in getting people the help that they need. So thank you for that.
Echoing everything Emily said, and really just appreciate everybody's time and attention and all the support and help you provide every day.
Great.
Hi,
Thank
I'm
you.
sorry. You made quick mention of a YouTube channel. I must have missed that early on.
Mass Housing does have a YouTube channel. Feel free to subscribe and watch all of our videos. We do upload some of our materials there as well. So we will send a link to that.
Oh, perfect. Because I think that would be something interesting for my seniors to sit and watch along with us. We
Sounds
could
great.
have a MassHealth connector / day. Thank you.
Thank you. Thanks, everyone. Be well.
Thank you.
Thank you all from
Thanks
Mass
all.
Housing, from Housing Stability. Thank you all again. Thanks to all of you, Nikki, Emily, and Toby, and the other folks from MassHealth and the Connector. And thanks, Dave, for moderating. And thank you, Kelly, for helping with production. We'll see you all soon. Enjoy your summer, everybody. Thank you.
Thanks, everyone.
Thank you. Have a good one.